Hi, my name is Imani.
My name is Ben Fertelman.
And my name is Destini Thomas.
Our clinical site was on 6 Northwest at University Hospital, which is a transplant unit. We decided to research the differences of giving shift change report at the bedside versus the nursing station. Bedside report is an important clinical practice because it gives oncoming nurses the opportunity to meet and assess the patient, provide more direct patient care time, and possibly alleviate any preconceived notions that may have been generated in report away from the patient.
Our PICO question was, within the inpatient populations, what is the effect of giving bedside report in comparison to giving report at the nurse's station on patient care outcomes?
The way we conducted our research was mostly through the University of Cincinnati libraries. We used CINAHL, which is the Clinical Index to Nursing and Allied Health Literature. By looking at our PICO question, we were able to pull some keywords and ideas out of it to help us narrow down our searches while using this database. Some of the keywords that we used were bedside report, patient care handoff, patient-centered care, and shift report. We found 3 research articles with all of them being qualitative studies. All 3 of them were at a level 2, with 2 of them being high quality and 1 of them being good quality. We also found 1 non-research article being a literature review at a level 5 high quality.
However, according to Advanced for Nurses, bedside report is a concept of giving report to the oncoming nurse in the patient's presence. Bedside report should include an opportunity for the patient to ask questions and receive clarification regarding his or her care. We had the pleasure of speaking to one of the nurses from the unit about the bedside report that's given on their unit. The first question we asked was, what is the policy here on 6 Northwest for shift change report?
Shift change report, we do at the bedside, theoretically.
And that's
head to toe assessments.
Yeah, just going through every system of the body.
okay. Where is shift change report typically given?
It's usually given up at the nurse's station.
Okay.
We're getting better at doing bedside, but that still is in the hall often, just outside of the room.
Okay.
A lot of times, at least in the morning, patients are asleep, and they don't want to. Yeah, they don't want to be woken up to just
Right.
go through that.
Do you think giving bedside report benefits the patient or the nurse or both?
Well, I think it benefits both when the patient knows what's going on, what the plan, just what's going to be happening that day is helpful. I know as a nurse, I might hear in a report that a patient has a certain drain or something, but actually seeing it at the bedside with the other nurse there is very helpful.
Would you, as nurses, recommend bedside report?
I recommend it. I believe there are some patients where it's not really needed, but definitely the heavier loads that have all the drains and the IVs going.
Okay. Do you, as nurses, think the patient will feel more comfortable when report is given at the bedside?
The patient, depends if there's family in the room.
If the patient's sleeping, a lot of them are going to be woken up just so you can talk to each other.
In conclusion, the evidence that we obtained from all of our articles supports that there are multiple benefits to both the patient and the nurse when the report is given at the bedside, such as reduced medication errors and giving more control to the patient. Bedside report should be given as long as giving report in the room does not break any HIPAA regulations. One example would be if there were multiple patients in one room. Further studies may be needed to get a better understanding of the correlation between the 2 methods of giving report.